So I've had a lot of recent requests regarding what I do with stem cell therapies. I've been interested in regenerative medicine and using nutrients for a long time, and a few years ago I started investigating how a family doctor could use stem cell and regenerative medicine. The first thing I started to do was platelet-rich plasma therapy, which is taking some of the blood from the body, from a vein, and spinning it down and creating a concentrated form of that to inject back into a joint or into the skin or into the scalp line for hair, or it can be injected in any part of the body. And I took some more courses on it, I did some more studying on it, and eventually I took a course on how to get stem cells from adipose tissue, which is fat, and how to get stem cells from the bone marrow. I learned how to do both. The adipose is a very simple procedure. The bone marrow is a little bit more complicated. I prefer not to do the bone marrow because it's a little invasive, and it means you actually have to tap into the bone, and it's a tiny little bone chip. Whereas the fat is a simple procedure, tiny little incision, we suck out some fat. It's like liposuction. We usually take 60 to 100 cc's of fat, and we concentrate the fat through a centrifuge, and we separate it and we rinse it and we process it. It takes a couple hours to do that, and what we get is a concentrated stem cell solution from the adipose tissue. We can then take that and give it back intravenously. We can give it back into a joint, we can give it back into the skin or the hair or any place in the body, and it causes a regenerative type of effect. Stem cells are the type of cells in your body that heal and repair. So if you have an injury or a cut or a tear of a piece of tissue, your body sends a signal, hey, repair me. And the first thing it does is send some blood cells there, typically platelets, to stop any bruising or bleeding. And the platelets then say, hey, we need to repair this area, and they send a signal, and stem cells that are always floating around in your body get triggered to that area to cause a healing response. And those stem cells are undifferentiated cells until they get to the area of injury, and then the body triggers them to turn into the type of tissue they need to. So when we get a stem cell treatment, we're basically giving a high dose of the regenerative cells that our body makes on a daily basis, and we're putting them into an area that needs more help. If we inject the stem cells back intravenously, we're getting a high dose of stem cells circulating. Those typically will go to the organs that are first passed through the blood, meaning they'll go to the lungs, they'll go to the kidney and liver, but they'll go wherever your body needs to put them at a concentrated level. So we find that the stem cells can help with a variety of conditions. Mostly people choose to do them for degenerative conditions and anti-aging conditions, liver, lung, heart, and basically stem cells heal all that ail you, and it's what your body would do naturally, but we're doing it at a concentrated level.